Welcome to the second Scrub-In video. With the first video, you learned how to access the platform, navigate the class, perform history taking, and make additions to the patient chart. These are all important skills that carry on to Level 2. Be sure to watch Scrub-In Level 1 before continuing. This tutorial covers the new skills needed for Level 2, history taking, and also physical examination. Since we have already learned history taking, let's jump ahead to physical examination. This is hands-on as you are now performing the exams and learning by doing. We have general exams and special exams. General exams begins with 3 components: vitals, methods of examination, and diagnostic instruments. Beginning with general exams, let's look at Jeremy's vitals and take his pulse.
Please give me your wrist so that I may check your pulse.
Notice how I start and stop the clock and count his pulse over here. Now let's look at blood pressure.
Please put your arm in this cuff so I can check your blood pressure.
I must pump the manometer and release the pressure. From here, I can determine the systolic and diastolic pressures. By zooming into his head,
I'm going to take a closer look at your head.
I'm prompted to use tools such as the speculum,
Please tilt your head up so I may use this speculum.
the tongue depressor,
Please let me use this tongue depressor to examine your mouth.
the otoscope,
Please sit still so I can use an otoscope to examine your ears.
and lastly, the ophthalmoscope.
Please look into the light on the ophthalmoscope.
And if there were any pathological changes, this would be displayed in Jeremy's imagery. Now if we zoom into his chest,
I'm going to take a closer look at your torso.
I can perform an auscultation.
I will use my stethoscope to examine you.
If you would like, you can use the clues here on where to place the stethoscope. Now we will hold and listen. We can rotate him around
Please turn. Please turn.
and continue to listen.
I will use my stethoscope to examine you.
Or the bronchial sounds above here. I can go in for some percussion.
I will inspect you by performing further examination.
Notice the resonant and dullness sounds featured. Now I will lie Jeremy down.
Please lay down.
I can listen once more to his stomach.
I will use my stethoscope to examine you.
And I can continue to the superficial palpation.
I will investigate using my hands. Please let me know if you feel uncomfortable.
Now in for the deep palpation.
I will investigate using a little more pressure. Please let me know if you feel any pain.
Once we have completed general exams, we can move on to special exams. For this section, we provide animation. I can navigate through the categories. Let us perform a palpation of the spleen.
I am going to palpate your abdomen for your spleen. Let me know if you feel any pain. Please take a deep breath. Please take a deep breath. Spleen is not palpable.
And if you are comfortable, you can search directly for an exam. Let's perform a Murphy sign.
I'm going to check your gallbladder. Please let me know if you feel any pain. Please take a deep breath in. Murphy test is negative.
Before finishing the physical examination, I would fill in my patient chart. Make sure you remember this step. This will allow your instructor to give you the best and most personalized feedback. Same as level 1, after completing a case, you can immediately review your results. Good luck, have fun, and happy learning! You are ready to scrub in for level 2.